All right. I think we are ready to get started with this webinar on sustainability in the pharma industry and how to communicate it. I would just like to say a few quick words as an introduction before giving the word over to our experts in the field, Maja and Camille. So what we'll be presenting here today is firstly a health check on the industry from a more environmental sustainability lens, where my colleague Maja Johannessen, who's a manager here with Nordic Sustainability, will go a little bit into the challenges and drivers of change, as well as how businesses in the industry is always driving change. We'll be doing that for Maja will be giving a presentation for approximately 20 minutes, and then there'll be some time for questions afterwards. And then I will hand the word over to Camille Aulkær Andersen, who is a partner and head of sustainability with Kompas, a communications agency that works a lot within the pharmaceutical industry. And Camille will be is probably better at describing exactly what it is that you do, but we thought we would team up here today because we think it makes a lot of sense to have this perspective from the more strategic side of things and change management point of view from Nordic Sustainability, and then coupled with this really in-depth knowledge around the communications aspects that are, as I hear them, Camille, and I understand them, a little bit complex and unique for the pharma industry. So we've been super excited to get this webinar going and try to share some of our learnings and some of our experience within this sector with you here today. I should say that you should really feel free to put forward any questions that you might have. You can do that in the chat. And then I will go through and try to direct as many as possible towards our panelists here today, so that we try to get some of your make sure you have some involvement as well. You should also feel free to debate and anything you would like to in the chat as we go. We don't have anything against that. Webinars are a communication form that's easy to access, but can also be a little bit tedious in how it is received from the attendee side. So if there's a discussion going in chats, that's not a problem for us at all. And before I give the word to Maja and then later on to Camille, I'd just like to say real briefly 2 words about Nordic Sustainability. We are a strategy and sustainability consultancy. We work with larger corporates to drive them towards change, towards scientifically set sustainability targets. We're quite ambitious on behalf of ourselves and our clients, and that means that we are always science-based. We're also a 4-day workweek company that tries to live sustainability also internally in that way. And with that quick introduction, I would just like to hand over the word to Maja Johannessen, who's a manager here with us. Maja, please do take it away.
Thank you, Esben. Yes, so Esben mentioned I'm manager at Nordic Sustainability. And just shortly to introduce myself, I have a background in environmental science and in circular economy. And as a consultant, I have also worked with companies in the pharma industry. So while I'm not sure I can claim myself to be an expert in pharma and sustainability, because those are both very big, broad fields, my aim of today was to give you a high-level run-through of some of the key challenges pharma faces in terms of environmental sustainability, but also give you some examples of what the industry and some industry players are already doing to address those challenges. So, and I'll try to keep it to 15, maximum 20 minutes, and then we can take some of your questions after that. But just to start out, so I mean, and I'll be focusing on the pharma industry in Europe, because of course the challenges are very different depending on where in the world you're located. So we have a European focus of today. In Europe, the pharma industry, of course, incredibly important industry. First of all, it's been absolutely key to improving quality of life in Europe. I mean, this is one of the main reasons why we have so long lives now since development, for example, of antibiotics. It's also a very important economic sector because it creates a lot of jobs. And actually, Europe export more pharmaceutical products than it imports, which means that it's also a very important sector in terms of the European trade balance. And that's just important to understand because it's an industry that's also in some areas, when it comes to at least to environmental sustainability, has been less regulated than some other sectors due to its important economic and social importance to the region. But what we're also seeing is that the industry, even though it has a very important and positive, handprint on the European society, it also has a very negative footprint on the global economy as overall. And that is, of course, because a lot of the pharmaceuticals do have a negative impact on environment, wildlife, and also human health when is it emitted into the environment. And until I think it was like 2006, there's been less regulation around doing proper risk assessments of pharmaceuticals, for example, which means that we have a lot of products that in the market and that products have been released to the environment that haven't been properly assessed. We also have a lot of antibiotics being released, and what we will dive into a bit later on. There's of course some really negative impacts related here, but there's also some interesting practices around the use of medicine that are currently also not really being addressed. For example, the massive overuse of antibiotics. When it comes to environmental impacts, we would always apply a supply chain or a value chain approach to understanding the full impact of either a sector or a specific company. So to really understand the footprint of a company, you would have to look at what are the impacts at the supply chain level. So what are the impacts of the main or the direct and indirect suppliers, who creates the active pharmaceutical ingredients or chemicals or raw materials that goes into the pharmaceutical products, as well as the impact occurring within the production within Europe. And then also look at what are the impacts at the use and the end of life phase of those pharmaceutical products, because you need that entire palette to truly understand what the impacts are. And that's also the approach that the EU is applying when they talk about impacts in their policies. So I'll just go through them a bit step by step. We just give a few examples of some of the key challenges that we have encountered. So starting with the supply chain and suppliers, and I think this is one of the most important steps in the value chain. So for example, when it comes to carbon emissions, I think for most companies, actually 70 to 90% of pharmaceutical companies' carbon footprint actually lies in their supply chain. So because most companies actually just procure ingredients that are produced elsewhere. Those, I think it's around, when it comes to European companies, 90% of the APIs that are sold in Europe actually are sourced from India and China, which means that a European pharma industry, of course, very reliant on those regions. But the challenge here is also that even though these regions have environmental regulation, it's not really being enforced, which also means that we have a lot of issues with leakage of polluting wastewater and also other harmful solid waste, for example. I just to give you, for those who haven't heard about this before, I thought it'd be nice to just have a more illustrative example. So focusing on Hyderabad, which is one of the world's largest pharmaceutical industrial areas. So they supply pharmaceutical ingredients and chemicals to companies all over the world. And they have, over the last 20 years, been in a legal battle with civil society around pollution. So they have really struggled with severe pollution in this area, even though the government has put in place a zero discharge law and tried to enforce some sort of stricter regulation. It's still not really being implemented. So I'm just going to go, I can click on there. And I just to give you just a sneak peek, I going to show you just a 1.5 minute of a documentary produced recently by the VD Center for Legal Policy, so a local think tank. And it's just to give you a sense of the issue.
Still, hazardous waste, toxic waste still gets dumped outside the premises of the industry. It reaches the lakes. It percolates into the groundwater. It is causing serious health disorders. So 2.5 decades is quite a significant time. And if courts have not been effective, then one has to really, it's for the courts to protect their own, dignity and respect. Community has always been looking towards the courts for some, justice and some sense of, relief.
People have changed their mindset and are moving away from their birthland, knowing very well that they have no future here.
और एक तो हमारा तालाब का पीछे जमीन 100 एकड़ जमीन है, उसमें किसका भी गांव वाले को जमीन ही नहीं है, बेच के बाहर चले जा रहा है।
ये गांव में पूरा इतना आदमी की बहुत तकलीफ है, बोलते बहुत तकलीफ है। 50 साल होने के बाद जिंदा बनने तो बहुत तकलीफ है, मरने के है मगर जिंदा तो बेस्ट है। अभी हम लोग का सूरत, हमारा सूरत 40 साल है, अभी मेरा सूरत देखो कैसे हो गए, हमारा बच्चे लोग कैसे होना, उन लोग कैसे जिंदा बोलो तो बहुत मुश्किल है। ये गांव में रहना बोलो तो भी बहुत मुश्किल है, हमारा भी नहीं, और लेडीज लोग भी गर्भाशय रहते ना, वो भी निकल जा रहा है।
So that was just a little run through some of the main issues, and I think it's just also a good case example of showing that environmental issues are very much also a social issue. And of course, the reason why the state has focused on attracting these types of businesses, and the reason why they actually decided to expand industrial area, is of course that it does create economic growth. The problem is, of course, that value doesn't necessarily benefit the people who live there. So anyone living out, like, doesn't work in pharma actually see growing poverty in this area. Yes, so yeah, so that was just an example. Then if we go down to the next step in the value chain, we have the production level, and this is then within Europe. And here, because we are within Europe, regulations are stricter, but they're also enforced. So we also see that, of course, there are still negative impacts here, but they're a lot less severe. So for example, when it comes to leakage into the waterways with hazardous or harmful substances, it's a lot less. I think the EU estimate that out of all the pharmaceuticals that end up in the European waterways, only 2% come from production. It doesn't mean that there isn't still accidents, and there still need to improve local waste treatment technologies in the production facilities or where they're located together with the local municipalities. But it is, of course, a lot better than if you compare to the countries outside Europe. Other typical things that companies experience here is, of course, also that they also generate solid waste, and especially depending on how they manage the wastewater, that might also generate hazardous solid waste that then need to deal with either through landfilling or incineration, which then again subsequently can create pollution. Similarly, there's also issues with water depletion. So within Europe, we do have areas that are at high risk of lacking water. So that is relevant for all industries working within Europe. For example, like in the area around Berlin, just as an example, it's very common that there is a water scarcity in those areas. So that's also, for some companies, they really need to manage how much water they are consuming. Then if we go one step further down the value chain, then we get to the use and the end of life phase. And for the pharma industry, it makes sense to just talk about those steps in one go, as when I take a pill, it's in the use phase, but it also kind of, as it goes through my body, is at the end of life at the same time. And when we talk about negative impacts at this level, I think one of the major ones that are being raised is, of course, the issues with bacteria that is becoming resistant to antibiotics. And it's described as one of the biggest threats to global health. I mean, it's almost at the same level as climate change. And just to put some numbers on it, right now, around 700,000 people die due to resistant infections on a global level, and around 33,000 in Europe at this point in time. And according to the OECD, they estimate that if no measures are taken, this will be increased to 10 million people a year on a global level by 2050. And that's actually more than people died of COVID or more people dying of cancer at this point. So of course, this would be a huge setback for humanity if this is not being dealt with. One of the major drivers of this massive use of antibiotics is actually that we just overuse it. So I think this is also a number taken from, I think, the OECD study, where they said around 50% of the antibiotics prescribed for human use are considered unnecessary. So that's on a global scale. And then also when you look at the agriculture sector, that number is expected to be a lot higher, because here you also use just antibiotics premeditatively, so just before the animals are even sick. So that, of course, also a big issue. Then, I mean, other issues that are also related to the use and end of life phase is just general leakage of our pharmaceuticals into the waterways, and that is, of course, linked to the fact that when we consume pharmaceuticals, we don't use all of it. So around, I think it's 30 to 90% of the APIs in the medicine is just going through our bodies and then out through the sewage systems and into the waterways. And even the best water treatment plants in Europe cannot remove all the substances. Some are better than others, but at this point in time, not 100% efficient. That also means that we see that there is increasingly amounts of pharmaceuticals in our environment and in our waterways. This is also from the same OECD study showing where they have found pharmaceuticals in the water environments. And as you can see, Europe is mostly green, yellow, orange, and red. And that's because we have a quite high level of consumption of pharmaceuticals here. The way pharmaceuticals go into the environment is either through the farming sector and coming through the animals, either and often here some of it just goes directly through the animals and then distributed over a field as manure. And then the other side of it is going through the humans. The EU estimate 88% of pharmaceuticals coming from humans is through after use, while actually 10% actually comes from improper disposal of pharmaceuticals. So I don't know if people have seen too many American movies where they pour out their pills in the toilet and flush them out. But that, of course, is not the way to dispose of pharmaceuticals. So there's also a big potential there just to educate people around just disposing of unused pharmaceuticals in the right ways. So just to kind of sum up on the main impacts, there has been a lot of focus on climate change and energy use, and of course this is an important area because we are reaching a tipping point for climate change, and when we go beyond that, it's difficult to do anything about it. And the pharmaceutical industry, which is very reliant on natural gas, is contributing to this issue. But it's also important to note that the pharmaceutical industry is also a very large and a relatively larger contributor to some other issues, such as pollution of our environment, which has a negative impact on biodiversity and access to clean water. So if pharmaceutical industries are aiming to become sustainable from an environmental perspective, they do need to tackle the impacts from a broader perspective than just focusing on transitioning the energy use. They also do really need to tackle the pollution issues. So as I mentioned, there is a lot of companies that are actually starting to do things differently, and there are some very important drivers behind that. Of course, there is a growing awareness about the ecological pressure and how that affects us as humans. But we also see that the driver is very much regulatory. So within, at least in Europe, the EU is very ambitious and setting new standards at a never seen before pace. This is also affecting investors. So companies that are dependent on external investments need to become more attracted towards those investors as well. The same goes towards customers. Customers, especially commercial customers, are starting to ask more about impacts and also having reliable data when they procure products and services. And then also in terms of attracting employees, being a company that actually contributes positively to society is increasingly important in order to retain and attract talent. And then finally, there's a lot of new information technology out there that also enables us to gather data and track and monitor our impacts and progress, which also is a major driver of actually starting to do things differently. Because the regulation in the moment seems to be one of the major drivers for change, I just thought it would be nice to just give you a quick overview of some of the key regulations relevant to the pharma industry from a sustainability point of view. So first of all, we have the European Green Deal. That is the EU's current growth strategy that was put in place as we got a new commission. The main point, or the most interesting point about the Green Deal, is that it kind of solidified a paradigm shift for the EU. So now the EU talks about growth within planetary boundary, and a growth that would lead to or economic development that leads to Europe becoming a climate neutral region. But also they mentioned a toxic-free environment as one of the key development objectives. And then, of course, that this green transition has to be fair and just. So of course, it also has to benefit everyone in society. And that out of the Green Deal, of course, that had pushed a lot of different policy initiatives, and I won't go through them all. I mean, feel free to ask if you have some specific questions. But I think, I mean, there's a lot of regulation regulating energy, of course, and also even more promoted by the issues in Ukraine and Russia. We have a new chemical strategies, which have led to just a few weeks ago a new policy on restricting the biggest ban ever seen on harmful substances, and that also includes new types of plastics. There's a new pharmaceutical strategy that also tries to tackle some of the pollution issues that I just mentioned. The new agricultural strategy, Farm to Fork, is actually also setting a reduction target for the use of antibiotics. And then in the bottom, we also have new reporting regulations. So companies now will, to a much larger degree, have to report in a valid and standardized way on like how many of the activities are actually considered green. So investors have a more valid information and will be able to compare company against each other when they have to decide on where they want to invest. And then finally, there's also going to be more stricter regulation on due diligence in the supply chain. So you will have to, in a much more diligent way, report on how you are measuring risk in your supply chain, and if they are detected, like how are you managing them and reducing those risks. Yeah, and I think just in terms of when it comes to environmental focus areas in the EU, we have climate has been the first topic that they dealt with and came out with guidance on how to report on. But as you also see, climate is not the only objective the EU cares about. Soon, within, I think already now, they're starting to release guidance on how to report on circular economy, pollution, water, biodiversity. So as a company, the sooner you'll be able to also perform in those areas, the more attractive you'll become, again, towards investors and customers. So I think I'm also running out of time now, but I just wanted to just say a few words on like what businesses can do. And we do see a lot of businesses are actually going beyond regulation and beyond compliance. So here just like 3 examples. AstraZeneca, for example, is interesting because they have a lot of initiatives targeting their supply chain. So really collaborating with their suppliers around reducing the negative impacts. And they also address the issues with harmful discharge from suppliers. Yeah. And then I think also Sanofi has some interesting initiative around measuring impacts of the medicine. So also looking into more a green drug design and less, better design of drugs. And also Novo Nordisk has been working much more proactively with their supply chain. So for example, set an absolute target for renewable energy in their supply chain, which I think goes beyond a lot of companies also in other sectors. So there's a lot of things to do, and I think I won't go into this in detail, but as you see, from the examples before, that when it comes to the upstream, yes, it's difficult to set maybe decide like this. You have not the same autonomy in terms of decision making when it comes to your suppliers, but there will be a trend that you'll be asked to work much more closely with your suppliers. And if your suppliers are larger than you can go together and work with peers to create that pressure. So we see a lot of industry collaboration actually arising here. And then, of course, on the downstream, it's around promoting sustainable consumer behavior. So promoting prudent use and proper disposal, work with also support the development of proper waste management infrastructure and so on. And then, of course, within your own operations, continue to reduce water use and waste production and transitions to green energy. And then in terms of like when to start, and often a lot of companies don't know really if this is if they're early on the journey. So we have often talking about this, like how do you get started? And this is a kind of a typical strategy and implementation journey for most companies that we've been working with. And often the first step is to just understand where you are. So do a thorough analysis across all sustainability areas to find your pain points and quantify what are your impacts. Then set a direction and define what are the areas you need to perform better in and how much. And then develop and implement an action plan. And as you can see from the graphic, this is it's often quite an iterative journey, because this is an area where it's really difficult to have full knowledge in. So you would also have to pave the way as you go and also be able to iterate as you gain new learnings. And then, of course, throughout this journey, you would have to also communicate a lot internally with everyone, all the relevant stakeholders you have within your company, and make sure that everyone is engaged at the right time. But then often when we talk to companies, they often be like, oh, but then like, when do we then have to talk about it publicly? And like, can we set targets? And like, we don't want to set targets if we, because what if the public knows and we don't reach them and so on. And that is, of course, really important questions. Therefore, I'm really happy to hand it over to Camille now to talk about then how do you actually communicate about sustainability, and especially in the pharma industry, that is quite a unique industry.
Thank you, Maja. And maybe I would just raise a question. Esben, should we deal with some of the questions that has come in the chat before I move on?
No, let's just take them in the end, because we're
okay. I'll probably address at least one of them I can see. So let me just share my screen. One moment. Yeah. So thank you for coming today, and I'll take over where Maja left, because if you agree on the sustainability importance, then you probably have to communicate it sooner or later, internally or externally, or both, hopefully both. I'll try to give you a few tips about that. I'm Camille, and I'm partner and head of sustainability at Kompas Communication. And just for the record, this photo is photoshopped. It's not real. You shouldn't use it. We in Kompas Communication, we deal a lot with the pharmaceutical industry. We've been doing that for 17 years, and so therefore we are taking over when Nordic Sustainability leaves, and try to help our clients communicate health and medicines issues. My background, just very briefly, is in public relations, and I've been working with communicating health and disease awareness and pharma products for the last 16 years, I think. So just actually starting from the bottom, you will hopefully go from here today with the following takeaways. I'll get into the details and hope you hang on for them, but hopefully you will leave here with knowing that you should think communication from day one. You should say something and acknowledge that you're on a journey. You should know your audience and the value of sustainability. Manage the 3 V's. I'll answer you what that is in a short moment. And comply with rules, of course. And the good old saying, show it, don't tell it. I'll get into details now what all this means. So first of all, just we'll try to answer why should you communicate about sustainability at all? And how can this be done in a legal and moral and ethical way? A way to grab this issue is to manage the 3 V's, value, viewpoint, and vehicle. And the first one, value, is about really acknowledging all the things that Maja said before, the importance of this. One of you asked in the chat, why should we really communicate or deal with this, because the patients can't choose themselves. I'll get into those details in just a short while, but this is really important that you really acknowledge the importance of sustainability and understand why it is important to strive for this also in the pharmaceutical sector. This issue is not nice to have anymore, it's need to have. This is a hygiene factor now. Because your industry, I'm sad to say, but it is filled with sad stories, and some of them are fair and some of them are probably not so fair, but it's blocking the side of some really fantastic developments through time, and you probably know more about them than I do. The COVID pandemic gave some goodwill to the pharmaceutical industry, but series like this, you probably already know it, took it away. And that is unfortunate, really. Some of you might feel the urge to not say anything at all, because it's very dangerous to speak about sustainability right now. You could risk saying something wrong or being accused of saying something greenwashing or whatever. This is a bad track record. Staying silent is not a good strategy. You should rather speak up with modesty and tell people that you're on a journey, you're trying to do something, at least just trying. If you stay silent, it can really stir suspicion. We've seen that in other industries, and you deal with plenty of that already. So this is not something you can afford not to talk loudly about, whether you are good at it or not. Also, I would say, and this is of course my postulate, but I would say that size equals obligations. You are a very big industry. Maja mentioned also already the antimicrobial resistance problem. Also, inequality in health and declining vaccine development is some of the issues that are really being put on the top of the list of the health issues related to sustainability. And in Denmark, a lot of people would probably say that we're a dairy country. We are not a dairy country. We're a medicines country. This is the largest export commodity at all. So I would say, you may disagree, but I would say that when medicine is that important to the Danish economy, we also have an obligation to handle it properly and sustainability, care about the sustainability issues. So finally, also, as Maja was mentioning, the world around you demands it. AMGOS is increasing the environmental demands now for large tenders. They are doing it even more in the future. They promised me, and EU regulates with increasing speed here. So also your employees, whether they're current or future employees, will ask this of you. They'll probably also demand it from you at a certain point. Soon, at least in the OTC sector, the consumers will be asking for greener alternatives. Right now, of course, a lot of our consumers in Denmark cannot ask for the medicines themselves. They cannot choose if they are in the hospitals. It's not a possibility to choose your medication yourself, but AMGOS and the hospitals might be doing this for us. So this is not a current issue right now, people asking actively for this, but this will probably be an issue in the future. Also, the media is putting a lot of attention to this, increasingly attention to this. This is just an episode in the radio 2 weeks ago. So a quick sum up of the value of communicating sustainability will be, this is a chance of attention. This is a possibility of valuable branding and profiling. And these sum ups is, of course, beyond the hygienic factor that you have to do this in order to meet the regulations. But also you can see these as these things as a plus. It will probably create some corporate pride as well. Recruiting and keeping workforce will be easier. It's a frame for new ideas and new partnerships. So there's a business development issue here as well. And of course, your customer care, whether this is hospital pharmacies, AMGOS, regular consumers as well. And of course, you need to be prepared and meet the demands from EU, from the government, from people and the media. There will be a lot more of this in the very near future. So, viewpoint, that's the next step. It's about taking a stand. Practice what you preach, walk the talk, you could say. You must really mean this profoundly. And that said, when you, for example, are talking about treating your supply chain good, or if you are buying things from people or using subcontractors, then you must treat them well. If you're saying that you will treat them well, this must also be their opinion. So it's not just about what you say, it's also about what people feel that you're saying. Can they really feel that this is something that you are being serious about? And so that's a bit more tricky. So this sustainability thing cannot just be an add-on. You must build a solid, honest, and ambitious and well thought through strategy. And that is what Maja was just saying, that is what Nordic Sustainability is doing. And then people like us come in the picture afterwards and doing maybe a more communications related strategy based on the sustainability strategy. And we would like you to have been thinking about communication from the beginning. because this is not just something you can move on to when all the other things are done. This should be thought from the beginning. Are your sustainable goals and action plans ambitious enough? Can they be communicated externally? This is really a difficult thing, and you should, if you haven't thought about this from the beginning, it will be difficult to modulate the strategy towards this in the end. How is the strategy coherent with your business area? Is sustainability just something that you've put on as an extra thing in your strategy, or is it your strategy? How can you use sustainability to leverage co-creation partnerships? Which stakeholders need to hear about it? I would say all of them, but you might not agree with that. How can you activate the strategy? So the last of the 3 V's is vehicle. And this is about doing it. This is about activating and communicating to all stakeholders, honestly, relatable, engaging. And here's when you have to prove that you really are sustainable, that you have something to bring to the table, that your intentions are good, that you really mean it, all the other stuff that we talked about before in the 2 first V's. And this requires that you love the rules, because you already have rules, and they're actually a little advantage of being a pharmaceutical company, because you're already used to working with the ENLI rules. And I hope that you all know what the ENLI rules are, and I won't go into details with them, but I'll just listed them very shortly, and they are abbreviated version here, so all the legal people would probably fall down their chairs right now because I've abbreviated it, so it's not very precisely written legally, but it's hopefully a bit more easy to understand for all of us right now. Just very quick, I won't read them out loud, you can read them yourself. But these are the ENLI rules, and you are used to them. You know them. You manage them very good in Denmark, and actually they are quite strict. And you're one of the only industries that have to deal with so many rules. So this will not be doing things by some specific rules should not really be a surprise to you. I would say you could do it. You are already used to being a Houdini, as I call it. You're tied on hands and feet, sunken to the bottom of the ocean, trying to be creative down there. That's how we communicate medicine in Denmark or in the Nordics today. So this should really not scare you. If some of you don't know who Houdini was, here he is. He's a breakout king. I think he was from Poland or Ukraine, actually. Learn to love all the rules. Right now, the sustainability rules are not really legal rules yet. They will be. Right now, it's guidelines that you should try to comply with, because the media and the people in general are very focused on this and have very sharp eyes out for people not complying with these guidelines. They are also, when we are working with rules in medicine's area, it is a good thing. I know some of you are probably quite fed up with them sometimes. We all are, I think, but it's the reason that we don't have a dope sick version in Denmark. And I think we should be very happy with that. So these are the so far rules, guidelines for communicating about sustainability. And I'll just get a quick run through of them for you. Communication should be correct, neutral, and clear. You cannot leave any significant information out. All claims need documentations. You're used to that already. You shouldn't ever praise your product or service. Don't compare. If you haven't a really good reason for it, that could be an environmental certification that allows you to compare. Otherwise, you should try to avoid that. avoid general terms like sustainable. Try to not use the word sustainable. It's quite hard, but it can be done. Green, eco-friendly, stuff like that. We don't really know. People doesn't really know what that means yet. It's still very fluffy. So it's a good thing to avoid it, and I'll show you how you can do it. Also try to remember that pictures, designs, colors are also part of your communications as well as words. Somebody asked me, should we just avoid using the color green in general? And I don't know the answer to that, but it's an interesting question. And try to accompany your promises by a plan. Do it like, I know Nordic Sustainability is very good at that. Try to show how you're gonna reach these goals instead of just promising. Learn to love wordings like strive and on a journey. You're not perfect, nobody is. And then show it, don't tell it, don't underestimate your receiver. It's people are not stupid. So they can see through this, and they would love to see you tell them how you are doing it, and showing them how you're doing it, and not just saying it with words. And remember that this is a very special issue when we're dealing with patients. Actually, this is quite an issue. You can very easily make patients feel that they are dealing, or they should be guilty for using maybe, for example, a medical device, but they can't, of course, choose it themselves, and they didn't choose their disease, they didn't choose their treatment, and now they are actually doing something that is not sustainable, and they feel bad about that. So we should try to show them a way, and not make them feel guilty about they have to use plastic or whatever medicine that goes out in the sewer system and stuff like that. So and I could highly recommend that if you don't already have this or have read it, then please download it. It's online. It's easy to go to. It's a quick guide from Forbrugerombudsmanden in Denmark, saying how to communicate about environmental stuff. A few fictional examples. These are very crazy. I will not show you examples of when some of you have done something bad. We all did at some point. So I will show you some very fictional examples on how not to communicate and make something graphical. They are actually showing things that have been done in the consumer or lifestyle sectors. So we have seen cars spitting out flowers. That's an actual example. Now I just converted it to an inhalator. We need documentation. Is 5% enough? If the production is harmful in general, I would say no. And of course, the graphics is totally misleading and terrible. We've also seen pictures of products being covered in grass, covered in leaves, stuff like that. It's not good. I think you can see this obviously. And of course, this would be a no-go as well. I have no words. But I thought it would be fun to just make a comparison regarding your branch here. If we could give some positive examples with no graphics still, some of them could be addressing that issue I told you before about don't make people feel guilty about the disease. So thanking them for doing something good, or telling that you're working on reducing something. That could be packaging in this case. Telling them about your process, maybe could be recycling, could be reuse, something like that. And also telling them that you're trying to fix something else, that's something that is not related to the product, maybe specifically, but is related to some of the environmental issues that is connected to. These are just examples. So, and just for a quick sum up here in the end, it is my I think it's very important to what Maja said before about don't focus totally on the climate issue, show how. If you, for example, are reducing outlet unpurified wastewater, show how if you're restoring biodiversity, show how if you're overusing or trying to reduce overuse of antibiotics. Again, if you're developing new vaccines, show us how you're doing it. If you are initiating more public-private partnerships, these are kept very secret, really. I think that's very sad, because this is a great method to moving the world in a better direction. Show us how you're doing it. We need good examples for all of this. We need to see when people are managing this in a good way. And I could go on and on, the list is long here. So your takeaways with a little more details here is think communication from day one, base your communication on doing a good, thorough strategy before. Say something and acknowledge you're on a journey. Nobody's perfect, neither you, be honest. And of course, mean business with sustainability. Know your audience, know that this is of great value to you and could be of even greater value. And if you're not doing it, it will be a disaster in the long run. Manage the 3 V's, use the rules, apply to the rules, expect your agency to know the rules as well and guide you in them if you are not secure. I think this is a hygiene factor for your agency as well. And be Houdini. And then show it, don't tell it. It's safer. It's much more interesting. Thank you.
Thank you so much, Camille. Much appreciated. I'm just going to jump straight to the questions here, just because we only have a few minutes left. I think I'm just going to start out with the first question that I think is directed towards the both of you, and maybe try and think about answering something you all haven't already specified. But there was a question early on around the competitive advantage of working on sustainability for pharmaceutical companies, given that maybe the financial reward in the tenders is not as clear as it could have been, or we would have liked it to be. So maybe maybe you can go first, but also to you, Camille. What do you see here as some of the key elements in why, from a competitiveness point of view, should pharma companies push forward on sustainability?
Yeah, so thank you, Esben. Thank you for the good question. I mean, in terms of competitiveness, I think I mentioned, so if you as a company are dependent on investments or getting loans from banks, your sustainability performance will be taken into account when you are trying to search for finance. So I think in that element, that's going to be increasingly important. And with the new standards on how you report on it, it's also going to be much more transparent how you actually are performing. Then in terms of, as I mentioned before, it's also something about internally retaining people, or also attracting new talent. This is also something that's really value driven for many people. So if you want to attract the right employees, this is also increasingly becoming important. As someone mentioned, right now, customers are not yet setting sustainability requirements that much in tenders, but they are also regulated by the same framework as you are. So those will probably also increasingly start asking for this. And then, as I mentioned, right now, there's generally a huge knowledge gap around pharma and the impacts of pharma in Europe, and it has been less regulated, but the EU is moving to close those knowledge gaps. And as they do, it's very likely to expect that they will start increasing regulations on the pharma industry as well, if they want to actually achieve and create a circular and safe economy as they set out in the Green Deal. So being ahead of regulation is definitely also a really important part of maintaining competitiveness.
Yeah, it is better to be ahead than to be the last one in the line. I would also say that regarding tenders, it might not be an economic benefit right now to be sustainable. or sustainable, but it will be an economic punishment. And in just a short while, it will be there will be tenders that you cannot win if you are not doing this. So right now we're just starting with the small steps like packaging, transportation, stuff like that. But in a while, I'm definitely counting on that this will be more extensive. So you can risk not winning.
Sorry, a quick question on plastics, Maja, just because I know it's something that you've been touching about. Just a real quick answer on your side, how to deal with the plastic pollution problem from the pharma industry.
Yes, so within pharma, there's a lot of companies focusing on packaging, and that's because that's what customers are currently focusing on, because they end up they're the one having to deal with packaging at the end of life. So we have companies that are looking into monomaterial. So rather than mixing aluminum and plastics, you would just have one material. So it's a lot more recyclable. Designing out PVC is a really important measure, because PVC, when it ends up in the packaging waste stream, it just kind of degrades other types of plastics and pollutes. So that's a general trend we see. Designing out PVC is important. And then you also see experimentation with other types of material, like blister packages made completely out of paper, for example, and so on. So there's a lot happening in that packaging space.
And we're happy to revert on anything by email afterwards. I think I can feel that Maja has more to say on this than we time. Final question for you, Camille, and I don't know if you can, how much you have to share here, but there was also a question around the medical equipment industry. How does some of those things that we've been talking about here today relate to that part of, maybe not the industry, but that other industry?
I think it really relates to all of it, whether it is the medicine in your device or the device itself. We have some great examples of some companies doing recycling of devices and developing projects with that in mind. I think that is in relation to what Maja just said about plastics. It's something that is very relatable for the client. Delivering your device back to the pharmacy, for example, that is a good thing. I think basically it's the same issues. You can't, maybe you can choose your inhalator or whatever, but there's a lot of different situation where you can't choose as a consumer, but we buy a lot of devices in the hospital sector as well, so maybe much more. So I would say that it's the same issues there. I'm not seeing it as two different sectors. Really, it's the same.
Yeah, thanks for that. And also just from our experience with working with companies in the medical equipment industry, a huge focus on circularity is of course a big advantage, right? Similar to what Camille just said, and then you have the advantage of, at least in some instances, to not be as having to be as focused on the after use element that Maja talked about. But I think we're gonna wrap it up here. A big thank you to Camille and to Maja for giving us those insights. If you want to follow up with us afterwards, please do go ahead. As I mentioned in the chat, we'll be sharing slides, and these presentations will also be made available via YouTube. Thank you so much for your participation today, and I'll leave you to go to other teams meetings and fun stuff, and have a wonderful evening for those of you who are on the same time zone as we are. Thank you so much. Bye bye.
Thank you very much.
Thank you.